Thanks for joining us for the daily update. There are 14,957 cumulative confirmed cases of coronavirus in Victoria. That's 322 new cases since yesterday. I'm saddened to have to report that there have been now 228 deaths due to this global pandemic in Victoria. That's an additional 19 fatalities since yesterday. Just for the purposes of clarity, there is an increase of 18 on the overall number of deaths. One death that was reported yesterday was removed from the tally due to duplication. They report very quickly, they do their level best, but from time to time we will need to adjust those numbers. That's why the tally won't quite reconcile. Of those 19 Victorians who have passed away, one male in his 50s, one female in her 60s, two males in their 70s, one male and six females in their 80s, and one male and seven females in their 90s. 14 of those 19 deaths are linked to aged care outbreaks. On behalf of all Victorians, we send our best wishes, our love and support, our condolences and sympathies to the families of those 19 Victorians. This will be an incredibly difficult time for them, and I hope knowing that all Victorians are with you is a comfort, some small comfort at a very difficult time. There are 640 Victorians in hospital. 47 of those are in intensive care, and 31 of those 47 are on a ventilator. A total of 1,820,598 tests have been processed since the beginning of the year, and we received 19,213 results since yesterday. There are 2,863 cases in aggregate with an unknown source. That's an increase of 105 since yesterday's report, so another 105 of those mystery cases, which are in many respects our greatest challenge. There are 1,065 healthcare workers who are active cases, so an increase on yesterday, but around that 1,000 number, which is where we've been for a few days now. There are 1,756 active cases in aged care settings, and the total active case number is 7,869. That, I think, deals with, and I should just say, the metro versus regional split, or the stage 4 versus stage 3 split in terms of active cases. My latest advice is that regional LGAs under stage 3 are still around 500 cases. So that is relatively stable, which is very important given our objective there to keep them low and drive them down even further. Again, can I just offer my thanks and praise to all of those Victorians who are following the rules and doing the right thing. It's very noticeable, both anecdotally, just by travelling in and back to where I live in the middle southeastern suburbs. There's just a fraction of the traffic on the road. A lot of the data confirms that as well. But it is really important that we all stay the course on this. It is a wicked enemy. It'll do everything it can to wear you down, and that's when it absolutely flourishes. When we let our guard down, when we are not, for instance, as signed up to these rules as we need to be. That's why I'm so grateful to those who are seeing this through and are making sure that in all the choices that they make, they're doing everything they can, not to contribute to the spread of the virus, but indeed limiting movement, limiting case numbers, and delivering us the objective that we're all focused on. Just before I ask Jenny to speak to a number of changes, as I indicated yesterday, we'd get you an update on some changes around call to test. So where you can't get out of home or where it's difficult to get to a testing site, we have a number of arrangements that we've got in place, and we're taking those to another level. Jenny can speak to that in a moment. I just wanted to draw your attention to a couple of things we're doing. Firstly, I'm going to show you a couple of ads which I think give you a sense of how dynamic and changing our comm strategy is. This is about trying to tell a story to as many Victorians as possible that this virus does not in any way discriminate between people based on age, based on their otherwise healthy status. So many people who have become positive and had very bad experiences were otherwise healthy and were younger, as well as the second of the two that I think we're going to show you. Firstly, Sarah and Sam, who are a younger couple with a couple of young boys. They're both midwives at the Royal Women's Hospital. They can tell their story. June, who is an older woman, she describes this growing phenomenon where both here and abroad we're seeing more and more evidence that this is not like the common cold. Even for those who get past it, it can have and does have for many people lingering chronic condition type impacts on people's quality of life. So in addition to these advertisements, which will be run on every conceivable platform, there's also, I can inform you, that we've shot a number of ads where nurses, they in fact have shot these ads themselves at our request, who are speaking to multicultural communities in their own language. And it's about sending that message in its clearest sense from a healthcare worker who is the last line of defence out to those for whom English proficiency may be an issue, sending that message of follow the rules, do the right thing, make the job of our health heroes just a little bit easier than it would otherwise be. This is a really important step forward. We've changed many times to try and refine the message, to target the message, and we will continue to do that. But I would just say, certainly from my sense of things at the moment, is that people, a larger percentage, a larger proportion of the Victorian community are doing the right thing than was the case a couple of weeks ago. And I think that's something that we should all be proud of. This strategy is difficult, it's heartbreaking, it's very challenging, but it's the only one that will drive down movement across Victoria and therefore drive down case numbers, and that's what we have to be focused on. I know there'll be questions about whether the relatively low number today marks any point of significance. Just in advance of that, I understand where those questions come from, but I think we've all got to be very careful not to be getting ahead of ourselves. We have one day's data. It's always better to be lower than it was the previous day, but it is only one day's data, and the stage 4 changes, many of which only came into effect midnight last night, a number of others which came into effect midnight Wednesday last week. The oldest of these being the curfew that had been in place for 1 week yesterday, as of 8 p.m. yesterday. So it is still very early for us to be trying to measure the impacts of stage 4, but we're certainly seeing perhaps some greater stability that is a result of the cumulative impact of stage 3. And I think yesterday or the day before we shared with you what our experts tell us would have been the case, many tens of thousands of cases if we had not gone to stage 3 and masks and the other settings we put in place. So that has achieved a lot. It just hasn't achieved as much as we need it to. It's brought some stability to the numbers, but we've got to drive them down so that we can reopen. Now I understand we have these ads, and I will now ask that they be played, and you can see.
I didn't think I had COVID. I didn't feel unwell. I felt like I was breathing normally. Because I was so badly infected, they had to get me on the ventilator fairly quickly. I was in the ICU for 32 days. I had a feeding tube on my face. I didn't know how serious it was. They thought that I might not live through the first night. Every day there was virtually no improvement. I'm fearful of brain damage. COVID has affected me physically. I have a weakness all down my right side. I have nerve damage in my right hand. Please listen to the medical experts because it's a terrible disease.
Dealing with COVID has been nothing like I've ever experienced before. It started off generally with the flu-like symptoms. I was almost debilitated with chest pain as well. The lining of my lungs became inflamed to the point where I wasn't able to fully inflate my lungs or exhale without excruciating pain. It feels like coronavirus has attacked every single one of my body systems. 4 weeks into my journey with COVID, I still feel like I'm incapacitated can't care for myself. I have 2 little boys and I decided to isolate away from them. They're with their dad half the time and they're with my parents. Being separated from them for 5 or 6 weeks now has been incredibly hard. It's absolutely heart-wrenching hearing them say, "Mummy, why are people doing the wrong things? Mummy, why isn't the coronavirus going away?" If you're thinking about bending the rules, think about who you love most in this world and think about them in ICU.
So I think from those stories, all Victorians should be in no doubt that this is a matter of life and death, and even for those who are able to survive this virus, there are lingering consequences. There are lingering impacts for many. That's not every patient, but it is enough and it is random enough that should be a timely reminder that we are all in this together. It does not discriminate, it doesn't stop, it is wicked, and it'll only be defeated if we are united, if we are determined, and if we see this thing through, if we stay the course. And that's why, again, I say thank you to everybody who, whenever they get symptoms, even the mildest of symptoms, they're coming forward and getting tested. If you've got mild symptoms, come forward, get tested, isolate until you get your result. If you are positive, then you need to isolate away from others. If you are anywhere in the state, anywhere, regardless of your circumstances, then you need to follow the rules. And they are different in regional Victoria versus metropolitan Melbourne, but if we don't follow these rules, if we don't all make our own contribution to limiting movement, the sheer number of people who are moving around the community, then we will not drive down these case numbers to an acceptable level that will allow us to reopen. I want businesses to survive. I want people back at work. I want people healthy. I want to begin that process of rebuilding our economy and community and setting us up for strength in the future. We simply can't get to that point unless we all play our part in making this strategy work. And again, that's why I'm so proud and grateful to the vast majority of Victorians who are. Again, those stories I think tell you a really powerful story about what is at stake here. Think about the person who is most important to you, and then think about them with a tube to help them breathe in intensive care for 32 days. That's how serious this is. That is how serious it is. It is a matter of life and death, and it is the greatest challenge that we have ever faced. Just before I invite Jenny to speak about some of our testing changes, I would again just remind, not that we need reminding, but I will make the point. We experience great adversity every summer. Every single summer. We experience really difficult times as a community often. That's the nature of the place where we live and the circumstances that we have to confront. We are strong, we are resilient, we are at our best when we are one, when we are together, when we look out for each other, when we understand that how all of us act, how all of us behave makes a difference, that even individual decisions can have a big and profound impact on much larger groups. That's when we are strongest. And just as it's true in summer with fires, all year round, all too often with drought, it's true in relation to coronavirus and our collective fight against it. I now might ask Jenny to speak to some testing changes, and then of course we're happy to take any questions you have.
Thanks, Premier, and good morning. So we've seen some very powerful stories there that really bring home the message very clearly to the entire Victorian community about what's at stake here and the need for all of us to be united in a common purpose, and that is to defeat this terrible virus. So we are starting now some new testing programs to make testing for coronavirus even easier than before. We know that for some vulnerable people, some people who might be housebound due to disability or other chronic health conditions, it is challenging for them to be able to present to a testing station, and we want to make sure that every Victorian has the opportunity to be tested for coronavirus. So we are starting a call to test program that will enable someone to call our coronavirus hotline. They'll be assessed by a nurse through that hotline, and with a GP referral, we'll go to them. We will go to people's homes and we will ensure that they will be able to get tested within a 48-hour period. So this is designed to ensure that approximately 200 vulnerable Victorians every day will have access to this new testing capacity, making sure that people who might have limited mobility due to disability or might have other vulnerabilities due to chronic health conditions can get testing in their own home. It is a free service and will be available throughout Victoria. The way that people will be able to access this is, as I said, through the coronavirus hotline. There'll be a triage there, and with a GP referral, we will come to you. So just in terms of other changes, we're also providing new rapid response teams. We are responding to outbreaks that are occurring particularly in Melbourne, but right across Victoria through our regional public health teams. We've got additional capacity there for testing. This is designed to essentially take a testing team on site to workplace and other locations and be able to test people more quickly and make it more accessible than ever before. So with these new innovations, we of course continue to roll out new testing sites across Victoria. We have more than 160 testing locations right across Victoria, whether they're drive-through testing sites, whether they're GP clinics or other locations. We want to continue to stress that it is important for people to continue to get tested, even if you have mild symptoms. Don't ignore them. Make sure you get tested at the earliest opportunity. Of course, there is now financial support available as well for people who are eligible if they're waiting for their test results, as well as people who may need to isolate at home if they test positive, and there's that additional $1,500 payment as well. So we are making it easier than ever before for people to get tested and then to get the support that they need as they wait for that test result. Thank you.
Take any questions you have.
Just on PPE, we know that you've said several times the warehouse is full. We've had our cameras out there. We can see the warehouse is full.
Yes.
If someone was to place an order today for PPE, when would that arrive?
I'd need to come back to you on the exact timing, but there are deliveries that are received by that warehouse every week, and there are shipments of PPE that go out every single day. I think that Monash Health has got a significant order going out today. Probably varies a little bit depending on what it is, whether it be quite a small order for one product or whether it's a much bigger order for a suite of different products. As you know, there's a number of different items. I'm certainly not aware of anything other than the timely delivery of what's needed. But again, just as we indicated that we would speak with the college around a survey that was done over the weekend. I know there's been a subsequent survey. We're always happy to sit down and get feedback direct to try and make sure we've got a system that is as good as it can possibly be. There's no issue about the quantities that we've got. The distribution network is, I think, working well, but no system's perfect. It may need to improve further. There might also be some communication challenges at that hospital level too, just to make sure that staff have got every sense that whatever they need, they'll get.
And on those N95 masks,
yes.
Hospitals are saying they're the ones they need, that they don't want the surgical ones, they want N95 masks. Is our supply good on those?
We have substantial reserves of those masks, but I think I referred a couple of days ago now, we had a meeting, it was a routine cabinet subcommittee meeting, I think it was Friday afternoon, where we approved further orders of a whole lot of gloves and gowns, including N95 masks. That was not just because we've got more patients in hospital and that's presenting us obviously with a bigger challenge than it was 2 or 3 weeks ago, but it's also a function of some of the changes we've made to continue some high risk workplaces because of essential food supply, for instance, but at dramatically reduced levels. They need extra PPE, and we wanted to make sure that that wasn't the difference between them complying. Exactly when those orders will arrive, I'm not sure, but there are, as I said yesterday, I think I've got the numbers here, 68 million gloves, 19 million surgical masks, 2 million face shields, together with many other products that are in the warehouse, and we get those out to people as quickly as we can. And again, I do want to take the opportunity just to say thank you to the team that have done an amazing job in procuring all of that, not just this week or this month, but right throughout the year. They have essentially been trying to source the same product as everybody else in the world at the same time, and it is a credit to them that they've been able to make sure we've got these sorts of stocks and that we keep adding to them each week.
Just on the N95 mask side,
Sure.
Would you consider mandating the use of N95s for all people who are coming into contact with suspected cases of COVID? That seems something this particular mask
Look,
seems to be the one.
I think that it is always best if people who are experts in infectious diseases and infection prevention and control make those sorts of judgments. I think that the Chief Health Officer has made some comments to that end. If you want a more complete picture about the logic that sits behind each of the decisions that are made from a guidance point of view, that's essentially what you're asking for. I'm happy to have Andrew Wilson, the Chief Medical Officer, speak with you.
Premier, it's clear from what you've just said that we do have the supplies of PPE. Dr. Mukesh Haikwal, the former AMA president, was saying this morning that the supply of PPE to frontline medicos and GPs in particular is still patchy. It would appear that part of the problem there is federal responsibilities. What work are you doing with the federal government to ensure that everyone, regardless of who they work for, all medicos have this equipment?
Well, with the greatest of respect to Mukesh, who I know and have worked with for a long time, he's raising issues on behalf of medical staff. There are obviously health is provided by a big team of people, some of which we have direct responsibility for, working in public hospitals, for instance. There are others, particularly in that GP network, where the Commonwealth Government would have a much greater role. But again, none of that matters much. It's all about making sure the right equipment gets to the right places in the most timely way possible. I'm more than happy to follow up any issues that he's raised. It may not be necessarily part of our distribution system, or it might be something that's more about public health networks and the Commonwealth Government, but I'm more than happy to chase that up. I'm confident that just as we've seen with aged care, just as we've seen on so many different fronts, the Commonwealth Government and our government, the public sector, the private sector, everybody is working together as best they can. But there's always that search for constant improvement. This thing is not static, it changes every day, and therefore you've got to be nimble. You've got to try and be as flexible as you can be to try and meet the challenges that this virus throws up to us each day. The timely provision of PPE obviously is a different challenge today with 640 Victorians in hospital than it was a couple of months ago. But I think we're equal to it, and everyone's working as hard as they possibly can. But I'm happy to follow up Mukesh's issues.
Do you have the figures of how many PPEs that healthcare workers use in a single week?
No, I don't, but I can get that for you. There will be someone, I'm confident, that has all of that and more, because it's all about that forward planning.
I just wonder if you've got a number in mind at the end of the 5 weeks. How do you know everyone wants this to work? Does it have to be under 100 cases a day?
Everybody wants this to work, except a small number of people who perhaps aren't making the right choices. And everybody wants me to be able to put a number on it. Everyone wants to know what's happening in October with footy. Everyone wants to know lots of stuff. That's fair enough. There is uncertainty, anxiety, there is a sense of concern in the community. There's no enjoyment in any of these settings. Very challenging, very, very challenging. If I could paint you a picture that had any kind of reliability for next week, let alone 5 weeks away, then of course I would. I've always been, I'm always happy to be corrected, but I have always been very, very careful when standing here not to take a day's data or even a week's data and try and put that out there as a trend. We are seeing some stability. That's a good thing, but that's not enough. And that's the product of masks and stage 3. That's what the experts tell us. The next stage, though, is all about these restrictions that we've had to painfully impose. But we just don't know, Raph. We can't predict where we'll be at the end of this. But what we can be certain of, without any doubt, that if we don't limit movement, we've got zero chance of driving down these numbers. That's why these decisions are important.
I'm asking for a number, not to mark you, but...
No, it's everyone would love a number.
Well,
This is,
if I could just ask this.
Sure.
There are a lot of people, I think, even inside the health department, who might say, okay, maybe we'll get to 200, but the difference between 220 is still precarious workers. Some of them are culturally and linguistically diverse. Some of them just aren't being paid much money. Is
Sure.
there enough being done to reach the people you don't know that you're reaching? I mean, that's the hard part.
I understand the point you
That's
make.
the tough part.
Yeah, it is. And if you look at the places in which this second wave is presenting, it is very different to the first wave, and it does present a range of unique challenges. There are payments there. There's an enormous amount of work being done by an equally large team to try and engage with all of those groups and indeed beyond those groups. On the issue of numbers, I can't give you a number. I know and understand that everyone wants to know when is this going to end. Everybody wants to know the circumstances in which it would end, and then they would very much like to be able to plot every day the numbers falling down to a magic number, as it were. We can't get to that point. On your broader issue about how confident are we that we're getting to the people that are overrepresented in this wave compared to the first wave, I think everything that can be done is being done. For instance, I don't have them here to show you, but having health professionals appeal directly to different communities in their first language, I think is a really simple but important thing to do. We are doing everything from really intensive work at the workplace, door to door, family to family, all the way through to broadcast messaging, multicultural media, all sorts of respected voices. There is an enormous amount going on, but even then,
Yeah.
you've always got to search for the next thing to do.
And not a criticism, but we've had a few people call us and say that there aren't signs in languages other than English in those essential distribution centres. I mean, is there any way of...
I'm happy to follow that up. I would have thought, just to be clear, it's the way distribution centres work, the way abattoirs work, the way all of these industries that are permitted, the way they work is it's not simply someone comes in and puts a sign up on the wall and that's all the due diligence for COVID safe. No. There are detailed briefings, beginning of shift, end of shift. There are all sorts of very personal ways in which we're trying to take what might at a time have worked as a broadcast message long time ago, first wave, but we've got to take it up a gear, and that's exactly what we've done. And not only that, and I'll have a bit more to say about this later in the week, but it's not just to sort of set and forget, here are the rules, you should follow them. There is an in-workplace compliance presence in many of those high-risk workplaces to monitor, to actually look over the shoulder of each shift and make sure that they're doing what they should be doing. And on the sign issue, I'm more than happy to chase that up.
Is there any more that should be done in the healthcare setting to get those numbers down for healthcare workers? That must be one big concern for you.
Well, it is. I don't want to see anybody getting infected with this virus. We've just seen some stories that tell you the real challenge of this thing. It's not just about those who die. It is also about lasting impacts for those who move past that initial period, but it can take a long time and it can leave a really lasting impact. In terms of healthcare workers, I don't want to see people who are there to provide care and support for others. I don't want to see them in harm's way. And the best thing we can do is obviously continue to provide all the protection we can, the different systems and processes, the way that hospital wards are essentially organised. But the other thing that we can all do, and in many respects the most powerful thing that we can all do, is to follow the rules, play our individual part, and do our bit to make sure there are less people in hospital, not more. And that's the best way to say thank you to our nurses, to our doctors, to our AMBOs, and to all the other non-clinical workers who are still part of the essential functioning of every single healthcare setting.
Premier, just with the clear face masks, not face screen,
Shields.
Shields.
Yep.
Are they an acceptable alternative to these masks? Some people are wearing them in public.
Yeah, they are. I think I'd probably have to come back to you on that. I think the answer is yes, but I'm more than happy to have the Chief Health Officer or other infection prevention and control experts come back to you. I know many people are wearing both, and certainly in healthcare settings, I think all of us probably have a greater understanding of these issues than we've ever had. There's been some particularly emotive videos and others have been posted where people have taken off all the PPE that they're wearing, having just come from a critical care unit. There's multiple layers, and shields are obviously a part of that also.
Just on contact tracing, we've had
Yes.
cases where people have waited a week before they've been notified, despite, in instance, a school telling them that someone in the class had it. They didn't get notified by the department for a week later. Is that acceptable?
Well, what I'd say to you is we've got to go by the data. And the data is we are getting to, if not 100%, then 99 point something of cases within 24 hours of us finding out from the lab, and we're working very hard to make sure we find out from the laboratories as quickly as we possibly can. You would appreciate, though, that that number is always very difficult to get to 100 because there's a number of factors. Particularly if you see this many aged care cases, there will be a number of people for whom it would just not be appropriate. People that have got dementia, for instance, you would never sit down and try and do the normal. Right. Yeah, hang on, I'm coming to that. Then there is a further metric, 48 hours beyond that notification to us of the case, we are to make contact with close contacts, and we are running at, I haven't got the exact number, but we're running, I think it's only single figures that we're not getting to in terms of percentage. So there'll be a variety of reasons. The other thing too, I think the Chief Health Officer is, and I'm happy to get you some more information on this. The Chief Health Officer, I think, has made the point, and it's a good point a number of times, that sometimes people can believe themselves to be a close contact and may expect a phone call, and I'm not criticising them for that. But it turns out, so for instance, a person, let's not use a school example, we'll use a workplace example. A person who works at that particular facility tests positive, it becomes known to his co-workers. There is then an assumption, well, they should all be tested, they should all be sent home to isolate, there should be all manner of things done, except for the fact that the person wasn't at work at any point during the time that they would have been infectious. So there are some subtleties to this. There's some layers, if you like, to this that are not always obvious. But we do our best. It's 2,400 people. They are working incredibly hard. The other point too that I think is really having a positive impact, given that volume is the friend of no system. If you finish up with as many cases as we've got, then no matter how many people you have working, there will always be challenges, because in any group of 100 people, if you try and ring them, no matter how many times you ring them, there'll always be a couple that you can't get to. If you're not dealing with 100 but you're dealing with 1,000, then obviously that number in raw terms becomes bigger and bigger and bigger. So the door knocking program, the partnership with the ADF and authorised officers of the health department, which again this week I'll try and give you an update on as well. They were up over 5,000 doors on Friday, and that'll be much more now. They had a big day yesterday, and they will continue. And as you know, as the balance of the 500 plus extra that we've sought, they'll move not just from door knocking cases, but door knocking close contacts. So all in all, the contact tracing team are doing an amazing job considering the volumes here. It is a big task, but we're being as nimble, to use that term again, as nimble and as responsive as we possibly can be. But with outbreaks, there'll always be some people who perhaps thought they might have been notified, might think they're in a different category than they actually are. And obviously we've got to prioritise the people that we actually have to call and have to contact. But there'll always be a few that where it does get challenging. That's the nature of having to deal with so many people every day.
Has compliance improved with the door knocking, the ADF? Has there been an improvement in compliance on...
Yeah, Victoria Police, I think it's fair to say Victoria Police are having less people referred to them, but they do have quite a significant number that they're still working through. I know this has been a matter of interest, but let's not divert our police from doing that work to provide an update, but I will provide an update as soon as I can. There were several hundred people that couldn't be found at home. As I've said all along, there'll be some that were doing the wrong thing. They might be at work, they might be at a friend's place, they might be just going about their business. There'll be other, as if they didn't have it. There'll be some people who've gone and isolated somewhere else. There'll be some people whose address is not accurate, despite our best efforts to look where they should reasonably be expected to be found. But Victoria Police have got to go through these meticulously. And look, that's the way you want it. You don't want a situation where people are instantly fined. There will also be the logical group of people who, for one reason or other, don't answer the door. So they're working through those. To answer your question though, Lundy, the sense I'm getting from the data and more broadly is that I think that the number of Victorians who are following the rules is going up. That doesn't mean though that we can in any way excuse the poor choices that some people are making. One bad choice by one person in the right circumstances, or the perfectly wrong circumstances if you like, where they're infectious, can lead to hundreds of cases, can lead to chains of transmission that we'll be chasing for weeks. So it's really important, not just for me or the government, or, you know, it's important to avoid telling a story like the one we just saw. It's important to avoid being part of a family that's planning a funeral. It's important to avoid a fine, and it's important to get to the other side of this, that each of us do the right thing.
Can I just ask if it's
Sure.
okay? Sorry. As the numbers go down, do we need to move ADF personnel from checkpoints and move them into doing more door knocks? Because do we keep them in place? Are we wasting our time with so many ADF personnel at checkpoints?
I don't think so. No, they provide support to Victoria Police. Those checkpoints are very important for lots of different reasons. We've got to limit movement. But again, just as I've said a few times now, this virus is not a static enemy. It's a particularly dynamic one, and therefore your response has to change over time. So we have more ADF today than we had a week ago. They've always been here right from the bushfires. Many have basically stayed, particularly those leading planners and taskers that have worked out of the State Control Centre now for months. But I certainly wouldn't rule out putting our resources so that we've got the best skills for the best purpose wherever the challenge presents, and the challenge changes.
On lab notifications, you said that more
Yes.
than 99%.
Well, almost 100%. So it's very, very significant.
Almost 100% of cases are followed up within 24 hours of getting a lab notification.
Correct.
On average, what's the time frame for a lab to notify you after getting
Sure.
the test?
I should be able to give you a more definitive answer. There is some variance lab to lab, so there's a benchmarking exercise going on at the moment to try and make sure that this is no commentary on any labs, but those who have consistently been quicker, we may push more tests to them. There's a whole, I think Brett the other day spoke about doing multiple courier runs, trying to do more. Again, as I said before, when you've got volume, you've got to try and find efficiency at every point. And sometimes that's about IT, sometimes it's about IT and then manual workarounds as well, common sense, logic, doing stuff the old-fashioned way sometimes. You know, ultimately, you know, we've got an app, but given where we're at and the fact that so much of this is being transmitted between people who know each other, it's not the app that's the key, it's knocking on people's doors. It's people calling out family members and saying, hang on, you've got a runny nose, you've got to go and get tested, and you've got to do it now. All of those things. So it's a mixture.
And ideally, would you like to get notifications from the lab within 24 hours? Or
I think we're definitely getting that. Well, in fact, we would be less than that. I think significantly less than that. But let me try and come back to you with some further detail.
Can we get some of that data? Like the number that Smaya's asking, and also the time it takes to contact people who are positive and their close contacts. New South Wales, I know they've got far fewer cases.
I'm more than happy, Raf, to come back with a picture on that. I'll try and, might not be able to give it to you all in necessarily one hit, but I'll try and give you some further details about all of those progressively throughout the week.
And has that lab notification improved? Because I recall Professor Saddam saying a few weeks ago that was a bit of an issue.
It was an issue. I think we're working, if you can, I think we're working even more closely with those labs, and we're getting turnarounds that are quicker. That's not a criticism of them in any way. It's about visibility and us beginning the processing work. I'll just draw you to, I know a couple of times I've said, we did for a few days last week, we had a estimated number of tests that we had done. So what we've moved to is, rather than spending time processing negative results, we were much more exclusively focused on the positives, so almost a separate reporting process for them. So all the way through, we're looking for. I don't think there's one thing that necessarily gives you half a day or a day. I think it's all small, incremental. It's minutes, maybe an hour. But if you add all those up and you're constantly every single day searching for them, then that means that you've got that constant improvement that's absolutely required, particularly as numbers continue to grow.
The number of cases under investigation does thankfully seem to have dropped by about 1,000 since last week. What has improved that? What do you attribute, that progress to, I guess?
I'm not sure. I'd have to speak to the team about whether they've had the time to be able to attribute any of that. But I think, perhaps I didn't phrase it properly. But the point I'm trying to make is I don't think there's kind of one thing that gets you a massive improvement. I think that the longer you're under sustained pressure because of volume, the more creative you get. You just have to, and there'll be some of it would be attributed to a whole range of processes that I probably take too long for me to go through each and every one of them. Some of it will be attributed to the door knocking program. Some of it will be attributed to stage 4 restrictions, curfews, things of that nature. It's easier perhaps to find people at home when by law they have to be.
3 deputy chief health officers as well, when previously we had 1. Do you think that's played a role?
Oh, it's a big team. What it says on people's business cards, I think, is probably less relevant than the fact that it's a big team and they're all working incredibly hard.
Premier, just on hotel quarantine.
Yes.
Was there a change in sort of policy and attitude from the program after the unfortunate suicide of a person staying in quarantine? Was there more emphasis put on helping, easing some of the needs of people in quarantine, including outdoor air breaks, etc.?
Oh, look, I've seen some reports today. I don't know the accuracy of those reports. That was, I think, probably speaks to at least that person's view. It speaks to things that are a tone or atmosphere very much on the ground. It doesn't speak, I don't think, to policy decisions. But all of those things will have to be tested. We did have a tragedy. We all know this, and I think we, subject to privacy and trying to be as sensitive as we could, I think we spoke to that in some detail at the time. I think it might have been off the record in many respects rather than something that was printed or broadcast, but we did have a person who took their own life as part of that program. That much is true. Beyond that, I can't really speak to some of the comments and the appraisals that are made in that report today, but that may well be of interest to Judge Scope.
And just with Victoria Police checking the credentials of security guards who were employed as part of the program?
Again, I'm not for a moment criticising the question or you're asking it, but those questions, I do not have answers to those questions. I need answers to those questions, so does every single Victorian, and that's why I've asked for a separate process to look into that. And I'd again just remind people that the program, insofar as it's taking return travellers from overseas, has been closed down. So there's no sense that we can't wait for those answers. I know it's frustrating, but we'll get them, and then we'll be accountable for them. There are some people in hotel quarantine though, but they're not people that have come back from overseas, and they are by and large people who have been offered an alternative place to live for their safety and the safety of their family, whether that be because of issues of family violence, issues of positive with vulnerable people in the household, being vulnerable and having positives in the household. They're all voluntary, if you like. They're a very different cohort of people. And then, of course, there's Hotels for Heroes, which is about trying to keep our nursing and other health staff safe.
Sorry.
No, you go.
Mine's not hotel quarantine, but not the inquiry.
Sure.
The case of the midwife or the nurse who tested positive to COVID-19, and her kids are now being looked after by their father or her own parents.
Yes.
If people live in small apartments, for example, they don't live with a vulnerable member, can they voluntarily elect to be part of this hotel quarantine program?
There are specific arrangements that we make for our health staff. There's also
I meant just overall.
broadly.
So if you're a mother, if you have young kids.
Yes, certainly we would always seek to work with you. If your domestic arrangements are not conducive to your safety or the safety of others, then health and safety, I should say. For some it is about safety, less about health, but we would always seek to try and provide you with an alternative place to live. And I haven't got an exact number, but we do have significant numbers of people. But again, they're very different. They're voluntary. Their circumstances may not be, but they've made a choice because we've had a conversation with them, we've worked through those issues. I think that system is working well. Even that system, though, is under the broader coordination and control of Corrections Victoria.
Okay, can I just ask a couple of questions on the meat industry?
Sure.
Do you feel that they have been able to adapt their businesses to meet stage 4 restrictions as well as securing supply?
Obviously, these arrangements are not very old. They haven't been in for very long. I'll be having a discussion and getting a detailed report back later today on a number of different settings, some that ticked over into stage 4 midnight Friday, some that ticked over last night. So I'll probably be in a better position to answer your question tomorrow. But my sense of it, and certainly the reports I've had in broad terms, is that industry, it is challenging to reduce particularly red meat down to 2/3, poultry down to 80%, some carve-outs for smaller operators, particularly in the seafood sector. This is not easy, but they're all working as hard as they can in as safe a way as they can to maintain that delicate balance, driving down movement, driving down positive cases, but also making sure there's enough basics on the shelf. As I've said a few times now, you mightn't get exactly the cut of meat you want. The warehouse changes as well beyond meat are a bit of a challenge in terms of the timely delivery of things, but if people don't buy more than they need, and to their credit, very few people will be happy about this, but I am, that supermarkets have stepped up and have put buying limits on a number of products. We can get to the other side of this without shortages of things people need. There may be from time to time shortages of some of the items you might want, but this is not an ordinary August. It's very, very different.
Will there be any consideration given to easing restrictions for regional abattoirs where there are very low or no cases?
Yeah, a couple of points. One, whilst there's in relative terms less cases in regional Victoria, and whilst there is some stability to those cases, I think we've got to be very careful. This is an integrated market, and the last thing we want is large volumes of work being exported from Melbourne into abattoirs and boning rooms and others in regional Victoria and potentially taking the virus with them. So it is challenging. We'll look at all these settings throughout the 6 weeks. We've made that clear. For instance, construction, we'll monitor that closely. But look, I think even as unpleasant as it is, I think business owners, industry leaders, workers, to whom I'm all very grateful for the power of work we've done to try and to listen, consult, thousands of meetings and calls and roundtables and all sorts of engagement. As unpleasant as it is, I think people accept and acknowledge that if we don't do this, we could well have more people going to work in August than last month, and that just means we'll have more virus. And 6 weeks, we won't be talking weeks, we'll be talking in months, and nobody wants that.
Is there information about some new cases at JBS Abattoir in Brooklyn?
No, I don't.
Advised to close?
No, I don't, but we're happy to chase it up. As you know, there's the Chief Health Officer's media release that'll come out around 1:30, 2 o'clock as usual, and that'll take you through any outbreak information we have, and if there's any follow-ups we can provide, then we will.
I'll just ask a question about regional recruiters. There's been an outbreak at the Buford-Saralgan aged care facility. Apparently families at the facility have been told they can remove their relatives from the site and care for them at home. Is that recommended practice? And I guess what are you doing to stop a potential outbreak at Saralgan like we've seen with others?
Sure, I would need to get updated on that outbreak. I'm happy to come back to you, and if you need further information for your regional colleagues, then we're happy to provide it.
The Royal Commission of Aged Care has heard this morning that the Federal Health Department nor the aged care regulator had a COVID plan for aged care homes. How does that, I guess, how do you respond to that given the efforts that have been put in and what we're facing right now?
Well, again, with the greatest of respect, and I understand that this is an issue that's very important, and I understand why you would ask the question, Rich, but I'm not going to respond to that and run a commentary on the adequacy or otherwise of arrangements that other governments have put in place, or private sector providers or agencies have put in place. I don't have the time for that, frankly. I'm exclusively focused on supporting residents and their families. That's why we've sent in nurses. They've worked 1,000 shifts, literally, putting themselves in harm's way. It's why yesterday, in one of the most confronting decisions that I've made, the notion of having to dramatically expand counselling support for nurses and personal care workers, because you can't unsee what some of them have seen in some aged care facilities. Yeah, there's a lot of work to do in this sector, and that's why there's a commission, and I want to commend the Prime Minister for setting it up.
Can I ask on aged care? St Basil said they notified the state government of a positive case on July 10. But the first the public were made aware of any cases at St Basil's was July 15. Why was there such a gap?
Well, I don't accept that the public health team did anything other than the very best job they could in full accordance with protocols. Now, I'm not here to have a crack at people at St Basil's, but I will just say, one minute we did too much, the next minute we didn't do enough. You know, there's a lot of emotion in that. There's not much to be gained by me trying to unravel that. We sent an entire workforce home because we did not have confidence that they were putting in place infection prevention and control. And that's what we did, and we were criticised for that. Now apparently we're being criticised for not doing enough. So again, there's probably not much to be gained by having a public stoush with the people who run that place. There are other forums where the adequacy of the response will be tested, many of which are a long way away from me. Rich has just asked me about one of them, as well as some other court action. The coroner, Justice Kane, will look at all of these issues. He's made that clear. And whatever support, whatever cooperation we can provide, of course we will.
Can we
Last questions, please.
Just, I wanted to invite the Health Minister. She said a lot on the weekend on Twitter.
Sure.
I don't know if you want to expand on that, if you want to say anything about that.
Thanks. Thanks for the question. What's the specifics
Well,
on it?
you're giving a deep apology online is one thing. I don't know if you feel the need to repeat that. I'm not saying you should repeat that, but that seems like a significant thing for someone in your position to say, and there seems to be a lot going on. I just wanted to know if you wanted to add.
Sure. Well, Raf, firstly, I think the tweets speak for themselves. I'm not going to be a commentator on myself. But what I would say is that, look, I think at this critical juncture where we've got stage 4 restrictions in Melbourne, stage 3 restrictions across Victoria, every Victorian making huge sacrifices, I've been concerned that the focus hasn't been, in terms of the public commentary, on the fight against the virus. And I think that's absolutely where the focus needs to be right now. I think we need to all have a common purpose on focusing on fighting this virus, and that's the message that I've tried to convey from the start, from day one. Is, as the Premier said before, you know, this is a life and death matter. We're seeing more and more Victorians losing a loved one each and every day, and I know that's heartbreaking for all Victorians to see those tragedies playing out. So this is in all of our hands. We are the front line, and we can turn this around if we all focus on the task at hand, and that is fighting this deadly virus.
You've said that no doubt mistakes were made along the way in the government's response to the pandemic. Did you have anything in particular in mind?
Look, that's for others to judge. You know, I'm not going to be a commentator on myself, as I said. There's an independent process underway, and I think it's important that that process is allowed to do its job without, you know, me or anyone else providing a daily running commentary.
Can I ask the Premier a question?
Sure.
And I'm not asking you to predict the future or even what next week is going to be like.
It's probably a good thing.
When Melbourne got out of, or when Victoria got out of stage 3 restrictions at the end of the first wave, we were pretty slow in opening up the economy. As we get out of stage 4 in Melbourne and stage 3 in regional rural Victoria, do you think there's a case for us to go even slower in terms of opening up the economy?
Look, it's your job and the job of others and the right of others to try and put descriptors on all the different decisions that we've made, whether they were fast or slow, whether they were too much or too little. What I can say is that all of those decisions and all of our decisions have been guided by the evidence of the evidence and advice of the public health team, and we will, when we get to that point. And again, whilst I was reticent, and as frank as I could be with Raf, that I simply can't put a number on these things, let alone a time sequence to correspond with that number, I don't want anyone to think that we aren't up to this. As a community, we, as a state, we have the fortitude, the resolve, the will, the resources to get beyond this if we all play our part. That's why it's so important that we all do that, and it's also why I'm so grateful to the vast majority of Victorians who are. When it comes time to consider what the next phase looks like, as you say, easing and the speed at which you might do that, we will be guided, as we've always been guided, by the public health advice and the experts who don't sit down with theories. They'll sit down and do deep analysis of the data, interrogate that as best they can, and come up with a set of policies that are both safe but have a degree of caution with them, but also allow us to reopen and find not normal, that is not on offer, but COVID normal. That's where we're headed.
And is it too early for the public health team at the moment to be analysing the data to see what the next phase could be?
They analyse data every day. In fact, it's almost in real time. And I think it's fair to say, though, that the data analytics capacity and work is very much focused on the epidemiology of right now and where the curve is going and how effective the strategy is. But there'll be other teams in the background, if you like, that'll be thinking about the next step and the step after that, even noting that this is with us for, in one form or another, it's with us for a very long time, unless, of course, something curative, treatment, or indeed the ultimate vaccine becomes available.
Yesterday I asked about cases in disability homes and
Yes.
I asked if there were any deaths.
I think we were, as I understood it, there was some breakdown provided in the release yesterday, in the show release yesterday. I thought.
Sorry, the 7 cases. I had asked if there were any deaths.
Oh, sorry.
In disability homes.
I don't have. If I had it, I would give you the answer, subject, of course, to not identifying anybody. I think I made those points yesterday, just about you might have such a small number that you could essentially identify the person. I'm not aware of any, but let me double check for that. As I understood it, following the questions yesterday, it was one of those matters that I took on notice, and I thought we had actually acquitted that. But let me on the whether anybody has died in connection with one of those facilities, let me come back to you. And what will guide that answer, not has it happened or hasn't it, but there's also a privacy issue there too.
Can you also maybe, when you do provide the update, can you let us know what kind of precautions you are taking in disability homes?
Sure. There's in broad terms, there's a response that is not dissimilar from a state control centre, central coordination that's not dissimilar to the aged care settings that we have in place.
And just quickly back on aged care,
Sure.
I know we've had large numbers of our aged care residents going to hospital.
Yes.
Can you clarify the protocol? Is it just people who tested positive, or is there a protocol for other residents as well?
There's a protocol that essentially each individual resident will be assessed, the facility will be assessed, and the first and foremost consideration is, can that resident, who really is in that context a patient, can that patient's needs be met in their home, in place, or do they need to be moved somewhere else? If it's a planned transfer, which would be more about, okay, we don't have confidence that there's infection prevention and control that can be maintained here, so over the next 2 days we're going to move a number of people. Those planned transfers have by and large gone to the private hospital system. Emergency transports, though, where there's a time critical nature around healthcare, they've come to our system. But the protocol, I think, is best summed up with what's the need, the most pressing need of each of those residents, and what setting will best meet that. Then just underneath that, obviously, does that resident and their positive status and the wildly infectious nature of this virus, does their presence in place pose a risk to others? And that's that point about shared bathrooms, for instance. It's been made a number of times. But those judgments are made by treating health workers, doctors and others. They'll make an assessment. Nurses, AMBOs will make an assessment about all of those issues. And then there is the other complicating factor of the end of life wishes and preferences that some of those residents, many of those residents, so not wanting to go through a particularly intensive intervention at the end of their life. And the other issue is how fragile might they be, and what risk does a move pose? I've spoken a few times now from my own experience doing other jobs many years ago now, that it is very, very confronting to move aged care, particularly high care. It is very confronting. To go to an unfamiliar environment can be really tough.
If I could just ask Mr. McCart once again about the social media and
Sure.
tweets. Sorry to bring you back, but can I ask what led to those tweets, why you felt passionate to put them out, and the timing around them? It was quite late, it was around midnight, how that occurred?
I work very late hours, but look, as I said before, I'm not going to be a commentator on myself. I think the tweets speak for themselves, but as I said earlier, I think it's important that we all focus on the task at hand. That's what I'm focused on every day. That's what I've been focused on from the day we had our first case back in January, and that is making sure we can fight this virus, make sure our health system is well prepared, make sure that the community is focused on what they need to do, and I'm grateful for the fact that overwhelmingly Victorians are doing the right thing. I'm hopeful that we are on a downward trend, but it's early days yet. We've still got many weeks to go under these restrictions, and we can only defeat this virus if we're all united with a common purpose.
Esther, if you had your time over, would you put those tweets out there again, given some of the responses you had?
Look, the tweets are there. People can form their own views about them. I'm not going to be a commentator on myself. I know many others have expressed views, but look, I'm focused on the task at hand. I'm not looking backwards, I'm looking forward. Others can look backwards. We've got an independent process that can analyse all of these things, go through thousands of pages of documents. I don't have time to do that. I won't be casting a judgment on myself or anybody else. That's for others to do. I'm focused on what needs to be done, and that is fighting this virus, and that's what I will continue to do each and every day.
Minister, just on that, how are you personally going?
Look, I'm focused on the task at hand, and I know that there are thousands of people devoted to this work, and I'm grateful for the huge amount of work that people are doing, particularly our dedicated healthcare workers who are putting themselves in harm's way, turning up to work, turning up to our hospitals on that last line of defence, and I'm so grateful to them for everything that they're doing, and there are many others, from Victoria Police to our people in our department, our contact tracing team, who are working incredibly hard and working incredibly long hours.
If you had your time over, would you still send out those tweets? You said you apologise for them. Sorry for what happened, but would you do that again?
Look, the tweets are there. They speak for themselves. I'm not going to be a commentator on myself.
Any other issues? If not, can we just simply say again thank you to all those Victorians who are taking this seriously, are doing the right thing. We're deeply grateful to you and very proud of you. We are a strong state. We will get past this, but only if we have that sense of unity and that absolute determination to get this job done. This virus wins when we don't take it seriously. This virus flourishes when even very small numbers of people make bad choices. That's why we're all in this together, and we've all got to work together and stay focused and see this through. And I'm confident that we will. If there's no other questions, we'll see you tomorrow.
Thank you.